Most headaches are harmless. They come from stress, dehydration, poor sleep, or long hours staring at a screen. They fade after rest, water, or a simple pain reliever, but occasionally, a headache is not just a headache, sometimes it is the body's early warning that something more serious is happening inside the brain or the nervous system. And the challenge is that the difference is not always obvious in the beginning. Knowing which warning signs deserve attention can make an important difference in how quickly someone seeks medical care. Headaches are one of the most common health complaints in the world. Millions of people experience them regularly, and for most people they are temporary and manageable. Because headaches are so common, many people automatically assume they are harmless. They treat the pain, wait for it to pass, and move on with their day. Most of the time, that approach is perfectly reasonable. However, certain patterns and symptoms can indicate that a headache may be linked to a more serious condition. Recognizing those patterns is an important part of protecting your health. This video explains several warning signs that medical professionals often consider when evaluating whether a headache might need further attention. The difficulty with headaches is that the symptom itself is very general. Many completely different conditions can cause head pain. A simple tension headache may feel like pressure around the forehead or temples. A migraine may cause throbbing pain, sensitivity to light, or nausea. Both can be extremely uncomfortable, but they are typically not dangerous. More serious problems can also produce headaches. These include bleeding in the brain, infections affecting the nervous system, or problems with blood vessels. The early symptoms may look similar at first. This overlap is why doctors pay close attention to certain warning signs that help separate common headaches from those that may require urgent evaluation. These warning signs are sometimes called red flags. They do not automatically mean something severe is happening, but they indicate that the situation should be assessed more carefully. Point 1 of the most important warning signs is a sudden and extremely severe headache. People sometimes describe this type of pain as the worst headache of their life. The pain can appear rapidly and reach maximum intensity within seconds or minutes. A headache that appears this suddenly and intensely can sometimes be associated with bleeding in the brain or other vascular problems. Because of that possibility, medical professionals usually recommend immediate evaluation if this type of headache occurs. Another important pattern involves headaches that appear together with neurological symptoms, for example, weakness in one side of the body, difficulty speaking, confusion, or problems with vision. These symptoms suggest that the nervous system may be involved. When a headache occurs alongside changes in speech, balance, coordination, or awareness, it may indicate that the brain is under stress or not receiving normal blood flow. Another warning sign involves headaches accompanied by fever, neck stiffness, or sensitivity to light. These symptoms can sometimes appear with infections affecting the brain or the tissues surrounding it. Although many illnesses can cause headaches with fever, severe neck stiffness combined with head pain can require prompt medical evaluation. Changes in headache patterns are also important. For people who experience headaches regularly, doctors often look for changes in how those headaches behave. For example, headaches that suddenly become more frequent, more intense, or different in character than usual. Someone who has had the same type of headache for years may notice when something about the pain feels unusual or unfamiliar. That change can be a reason to discuss the symptoms with a healthcare professional. Another factor that doctors consider is the age at which headaches first appear. New headaches that begin after the age of 50 are often evaluated more carefully. This is because certain medical conditions associated with blood vessels or inflammation become more common later in life. Headaches that appear after a head injury are another situation that deserves attention. Even minor injuries can sometimes cause bleeding or swelling inside the skull. If a headache appears or worsens after hitting the head, medical evaluation can help rule out complications. There are also situations where headaches appear together with persistent vomiting, severe dizziness, or difficulty staying awake. These symptoms may indicate increased pressure inside the skull or other neurological concerns. It is important to understand that none of these signs automatically confirm a serious condition. Many people experience one or more of these symptoms for reasons that turn out to be harmless. However, these patterns help doctors decide when additional testing or evaluation is appropriate. The goal is not to create alarm, but to recognize when the body may be signaling that something deserves closer attention. The most useful way to think about headaches is not simply in terms of pain intensity. Instead, it is helpful to look at the overall pattern. Doctors often evaluate headaches by asking a few basic questions. Did the pain start suddenly or gradually? Is this headache similar to ones you have had before? Are there other symptoms appearing at the same time? Has the pattern changed recently? these questions help build a clearer picture of what might be happening. Most headaches will still fall into the category of tension headaches or migraines, but when certain warning signs appear together, they provide clues that the body may need further medical evaluation. In other words, the context of the headache often matters more than the pain itself. Headaches are extremely common, and most of them are temporary and manageable. However, certain warning signs deserve attention. Sudden and severe headaches, neurological symptoms, changes in normal headache patterns, fever with neck stiffness, and headaches following head injury are all situations that medical professionals take seriously. These signs do not automatically mean that something dangerous is happening, but they can indicate that further evaluation is needed. Learning to recognize these patterns can help people make better decisions about when to seek medical care. In many cases, early attention simply provides reassurance. In other cases, it helps identify problems early when treatment is most effective. Understanding the difference between common headaches and potential warning signs is a practical step toward protecting long-term health. If you find explanations like this useful, consider subscribing to the channel. You can also check the description for additional resources that summarize the key warning signs discussed in this video, which can be helpful if you want to review them later or share them with someone who might benefit from the information.